Have better good morning? Yeah, so now I understand everybody had breakfast and came, right? Yes? Okay. So we will be talking about patient referrals, how to send and when to send. Okay. So before that, what do you mean by referrals? So if you go by referral, nowadays we hear, right? Refer a friend for something and you will earn some points. So we are not talking about that referrals here. We are talking something called as medical referrals, right? So medical referrals are something whenever we direct a patient to a specialist or whenever in medicine we refer any patient with care to a clinician or any clinics, that is called as a referral. So here we are talking mainly about the medical referral. As a practitioners, we do refer the patient whenever required, and we do get a referral from somebody also. So we are going to see some journey. Before that, the word which I want to highlight is a care. Whenever we refer, I think we care about the patient, we should have a concern about the patient, and that's why for the benefit of the patient, we refer, right? So yeah, this is something I think the moment I want to send the patient to somebody, we'll try to magnify and see, should I send? What if my friend will take away my patient, right? What will happen if patient does not come back to me? What will happen that I will keep on losing the patient over and over, right? I see a lot of fear as a practitioner when I think about it, and I think many of the practitioner also will be having that in mind. So yes, whenever we talk about referral, the first thing comes in mind, are we ready for referrals? Are we as a practitioner, and tomorrow I see a lot of students who are here, are we ready for the referral as such? Our mind is ready to send the patient to somebody, whether it's our own colleague or some other specialty, right? So yes, I will again ask this question at the end of the session. Hopefully, I want to receive the answer something from you. So before that, I think we know as an optometrist, we should have certain skills before we refer. So optometrists should have a knowledge, they should have a necessary equipment, and they should have a competence also. And that is where we will be able to provide eye care, and also we know whom should we refer further, right? And these are the places where all the optometrists are generally working. You see optoms are working in many eye institute where you have a lot of specialty. You have private clinics where ophthalmologists where we do refer. We do have private optometry clinic where practice happens. Other than that, opticals and corporates are a part of it. And I think a question for you, anybody wants to take up? So here is a case where we have a patient, 8-year-old, and he has no history of glasses. He just walks in the clinic, and you do a refraction, you did a complete evaluation, and you found the refraction is this much. What will you do? Will you just dispense the glasses, or yeah? So yes, this has to be referred. You may have done a perfect refraction for this patient, but being a first-time wearer and looking at the power, I think the retina evaluation has to be done for this patient, right? So it has to be referred further. The second case, if you look at where you have a private optometry clinic, you get a case of 65-year-old patient who has like cataract, and he also has a diabetes as such. And if the patient comes to you, again, will you refer or will you try to treat by yourself? Right? So these are just few examples where the referral is required. Now, why do we need a referral as such? Few things, yes, to avoid the risk, to take care of emergencies as such, there is somebody who can deal with this kind of conditions better than us, like a cataract, right? Or to build a practice over a period. Other than that, I think we know for eye health and the functional vision, what we need to restore is a quality of life of the patient. So that has to be kept in mind. Now, these are few arms which we have to keep in mind whenever we think about urgent conditions. We can take care of emergencies only when we can early diagnose, we can screen them, or we can promptly give a treatment to the patient. Now, the major goals of the referrals is to maximize the quality of life of the patient and also to identify the emergency in terms of site-threatening emergencies, which is important. So what are the types of referral generally we see? So there are majorly two types what we observe. One is urgent, where the patient needs an urgent attention, which has to be taken care within 24 hours to 72 hours. And there is something called as ordinary references, which maybe if the patient goes within a week or a month, that should be fine, right? So these are the, depending upon the condition, you need to keep in mind that should I refer the patient on urgent basis or a ordinary basis? Suppose the patient comes with a injury and there is a lot of trauma to the eye. Will you just start treating the patient, or what type of referral will be that? Yeah, it will be an emergency, right? Yes. So we'll just go ahead and try to see how do we refer, or how should the referral happen. So if you look at here, the referral happens includes most of the practices if you look at that. So from optical, we refer to the clinic or an institute where we have all the specialty or all the instruments available, I would say. And from the community also, we get a referral to the clinic and the institute. So whom do we refer? Generally, we can refer to all the multi-specialty or the specialist wherever or whenever required. Yes, to sir also. So we have ophthalmologist, optometrist, physician, pathologist, psychologist. Out of all of this, I would like to pay attention to ourselves. Do we refer a patient to a fellow optometrist? Okay, I think that plays an important role. We'll see further how can we refer to a fellow optometrist also, right? So when should we refer? So generally for an ophthalmologist, if you see, whenever there is a signs and symptoms of any condition where, as I gave an example of injury, or if there is any cataract, any retinal problem, any glaucoma, any pediatric or neurological issue, yes, you have to refer the patient to ophthalmologist. Now, in ophthalmology, even for the diagnostic, we refer the patient whenever, if you don't have all the instrument with you. Other than that, for surgery, definitely you have to refer to ophthalmologist, and few of the examples are there. Now, for medicine, whenever there is a condition of infection, inflammation, or glaucoma, in all the cases, we refer the patient. Now, yes, as I mentioned, the more attention is to this. Now, somebody is practicing contact lenses, and you have a patient of binocular vision abnormality. What will you do? Will you try to what will be done? I mean, suppose an optometrist here, practitioner, few of you, suppose you have a patient you are practicing contact lens, but you come across a case of maybe convergence insufficiency or certain case where you need an exercise. What can be done? Will you try to, yeah. So certain thing, I think everybody knows basic few things which can be managed by yourself. Why I'm telling you, certain specialty may not be practiced by everybody. So we also have to encourage to give a reference to our fellow colleagues. So specialties done by optometrists, we have binocular vision, we have low vision, yes, artificial eye, contact lenses, and also myopia control. Now, whenever we go talk about other streams, so there is a patient who comes with a specific problem, and if he has a diabetes or some other issue, so definitely you would like to send the patient to a physician. If there is an issue with the sinus, definitely you would like to send the patient to a ENT specialist as such. Yes, let's talk about more referrals. Now, what are called as correct referrals? So, is all the referrals are correct? Do you think? So, if you think yes or no, the answer is no. There are two types of, again, referrals. One we call as true positive, where you said the patient has some problem, and yes, it is diagnosed with the same thing. For example, patient has a cataract, you refer to a clinic, and the patient, yes, he has a cataract, right? So that is something called as a true positive. There is something called as false positive. So false positive is nothing but, yes, you referred the patient, but there is an absence of a condition which is present. Now this false positive will decrease as you experience or as the time goes. With that, the false positive will decrease. Now there is a study which was done, and I think animation is not working, which just want to pay an attention to the chart which is there. So in this, they have sent a referral to optometrist sent a referral, and 60% of the time it was come around false positive. False positive was 29%, and the correct diagnosis was 67%. If you see here, what happens to a patient who goes, so in this study they have represented why the referral happened. So most of the referral here is because of the retina and other condition also. Now, there is something called as co-management. It's not only you refer the patient, sometimes you manage the patient with fellow person. So in this particular study, they have done the co-management with keratoconus patient, and the patient was referred for CTR, and it came back to a practitioner again for further interdisciplinary collaboration, I would say, mainly for the contact lens treatment. So there has to be a reference letter which has to be managed. It should have a specific structure, and it should include a relevant clinical information, I would say. So this is a few example of a reference letter, how it should be. So it should have a specific content like your clinic name, why are you referring, the name of the patient, if you can write preliminary evaluation, and also if you can write the diagnosis of the patient. It should also contain some part, your name, your clinic name, designation, and also services available. Why is this important? Because when you are referring and somebody sees what are the services are available at your clinic, there is a possibility that they will also send back the patient, right? So that's why whenever you send a referral letter, it's important not only to mention your name, you mention what all facilities or what all services are available at your clinic. Yes, at the end, yes, we all are looking for vision, which is a life. We don't have to think about, like, we just have to give a better life to the patient. It's our responsibility as such by referring a patient to give a better quality of life. And rather than thinking whether the patient go, we just have to think how can the patient get treated better, right? So these are few sources which are available online where you can manage the patient referral just for the reference. And these are few key points from today. We always have to remember that patients buy solution to their problem, right? And by giving a high quality of services, it's our responsibility. And if you have a positive expectation from your patient, they will always come back to you, right? And yes, there is a competition, there are many things going on, but if your intentions are good and if you are referring the patient for their own benefit, I think they will come back to you, right? And we do have to join hands together with fellow colleagues, whether from same discipline or some other discipline, for the benefit of the patient, right? So somebody said, and I truly believe in this, do what you do so well that people cannot resist telling others about you. So be good in your own practice. Don't think about others. Don't think about patient will leave me, he will never come back. Be good and practice well so that the patient will never come back. Patient will always come back to you, right?